Hello guys, welcome to SKK Classes NZ again. Today we are going to discuss about one of the common topic, that is hypertension. So today in our video we will discuss about what is hypertension, what are the main signs symptoms of hypertension, and what type of treatment that can be provided to the patient or the person, and what are the main serious complications that can occur if the hypertension can be left untreated. So first let's discuss about hypertension, that what it is. Hypertension means high blood pressure. I think this now you people are very much familiar about this term and this word, because hypertension is the main problem which can occur with any person. Okay, mostly every person here in our world is suffered from hypertension, means high blood pressure. So what is actually high blood pressure? So when the pressure between the blood vessels that gonna high, okay, as you people that our normal blood pressure is 120 by 80 mm of Hg. Okay, but if the limit or the range or the value of high blood pressure is more than 120 via 80, or it lies between 140 via 90, then we can say that this person is hypertensive, means this person is having a high blood pressure. And today in our video we will discuss about what are the main sign symptoms of hypertension. And so let's start with the sign symptoms. Now see, in this video first we will discuss about the normal blood pressure. So our normal blood pressure is 120 via 80 mm of Hg. Now what is 120 and what is 80? So we have two blood pressures, and upper one is known as systolic blood pressure and lower one is known as diastolic blood pressure. So what is systolic blood pressure? Systolic blood pressure is the pressure which of the blood, okay, which is exerted by the blood when it is going to be ejected into the arteries. Means when oxygenated blood that will goes into arteries, at that time what the pressure will be created within the blood vessels, that is known as your systolic blood pressure. And normal systolic blood pressure is your 120 mm of Hg. And what is diastolic blood pressure? That is lower one. That is the pressure of the blood which exerts within the arteries between heartbeats. Means between two heartbeats, the pressure exerted by the blood within the arteries, that is known as your diastolic blood pressure. And its normal limit is 80 mm of Hg or below. So this is your normal blood pressure, that 120 via 80 mm of Hg. So this is your normal limit of blood pressure, that is 120 via 80. That is 120 is your systolic blood pressure and 80 is your diastolic blood pressure. Now we will discuss that what will happen that when its normal value gonna high, and what is actually hypertension. Now see, in this picture the range of blood pressure is given. Okay, so your healthy blood pressure, that is systolic, is less than 120 and diastolic is 80 mm of Hg. And when it gonna high a little bit, like your blood pressure ranges between 120 to 130 or less than 80, then it is known as elevated blood pressure. Okay, it means it started high. Then there are three phases of hypertension: stage 1, stage 2 and hypertension crisis. What happen in the stage 1 hypertension? If your blood pressure lies between 130 to 139, okay, or 80 to 90, or you can say if your blood pressure is 140 or by 90, then it is your first stage of hypertension and you have to take care of this. Then in what happen in second stage of hypertension, that your blood pressure will be more than 140, okay, and your diastolic blood pressure, that is more than 90. So this is the second stage of hypertension. And last one is your hypertension crisis, means if your blood pressure is more than 180 mm of Hg and diastolic blood pressure is more than 120 mm of Hg. So this is the condition that at any stage, okay, any emergency can happen. So you have to be very much careful about this thing. So now let's discuss what are the main warning signs of blood pressure if it is high. means from where we can judge that this patient or this person is having a high blood pressure. So now you can understand that what is hypertension, what are the main stages. Okay, so there are 3 stages. Stage 1, in which your blood pressure is more than 130, and stage 2 if your blood pressure is more than 140/90, and stage 3, or you can say hypertension crisis, when your blood pressure is more than 180 mm of Hg. Okay, so now let's discuss what are the main signs symptoms. Okay, means if the patient is suffering from hypertension, then patient always will say that I'm having a headache. Okay, and the headache will be severe. Then patient always have a chest pain, and he or she can feel dizziness. Then sometimes patient feel difficulty in breathing if his or her blood pressure is gonna very much high. And sometimes some patients feel nausea, vomiting, and there you can say the patient's vision that can be get blurred. Okay, means patient is unable to see anything very much clearly, and some patients feel anxiety. Okay, so these are the main symptoms from where we can judge that this patient can have a high blood pressure. So what is the main actual thing that how we can know? We have to check the blood pressure of that person or the patient, so that we should know that this patient blood pressure is high, and according to that we can start the treatment of the patient. Okay, so we have already discussed what is hypertension, what are the main stages of hypertension, and what are the main warning signs from where we can know that this patient or person is having a hypertension or high blood pressure. So in our next video, we will discuss about the main causes of hypertension and what type of diet that should be followed if the patient is having a high blood pressure, and what is the main treatment should be given to the patient or the person if he or she is suffering from high blood pressure. So till then, you have to wait, and thank you for watching SKK Classes NZ.